The world's largest study of the impact of temperature changes and kidney disease reveals that 7.4% of all hospitalizations for renal disease can be attributed to an increase in temperature. In Brazil, where the study was focused, this equated to more than 202,000 cases of kidney disease from the year 2000 to 2015. The study, led by Professor Yuming Goh and Dr. Sanson Lee from Planetary Health at Monash University and published in the Lancet Regional Health Americas journal, for the first time quantifies the risk and attributable burden for hospitalizations of renal diseases related to ambient temperature using daily hospital admission data from 1,816 cities in Brazil. The study comes as the world focuses on the impact of climate change at the COP26 conference in Glasgow from 31st October. In 2017, a landmark article in the Lancet declared renal diseases a global public health concern, estimating that almost 2.6 million deaths were attributable to impaired kidney function that year. Importantly, the incidence of death from kidney disease had risen 26.6% compared to a decade previously, an increase that this study may indicate was in part caused by climate change. The study looked at a total of more than 2.7 million hospitalizations for renal diseases recorded during the study period. According to Professor Yuming Goh, for every 1 degree Celsius increase in daily mean temperature, there is an almost 1% increase in renal disease, with those most impacted being women, children under 4 years of age and those 80 plus years of age. The associations between temperature and renal diseases were largest on the day of the exposure to extreme temperatures, but remained for 1 to 2 days post-exposure. In the paper, the authors, who are also from the University of Sao Paulo, argue that the study provides robust evidence that more policies should be developed to prevent heat-related hospitalizations and mitigate climate change. The authors advise interventions should be urgently incorporated into government policy on climate change, including particularly targeting specific individuals, including females, children, adolescents, and the elderly, as they are more vulnerable to heat with regard to renal diseases.